Are you an expectant father feeling a mix of excitement and anxiety? It's completely normal, and we've got you covered. Stepping into this new role can be both thrilling and terrifying. You might be wondering about the birthing process, what your role will be, and how you can best support your partner, right? Well, you're not alone. Let's debunk some myths and shed light on the reality of what to expect. From understanding the stages of labor to knowing what to expect once you're at the hospital, we'll guide you through. We'll explore your crucial role in the delivery room and share some comfort measures for your partner. The birthing process is not just about the physical act of delivering a baby. It's an emotional journey that you and your partner will embark on together. Let's dive into this journey together and make you the best birthing partner you can be. First, let's understand the stages of labor. It's not as scary as it sounds. Labor is typically divided into three main stages: early labor, active labor, and transitional labor. Early labor is the longest but least intense phase. Contractions become more regular, but they're manageable. This is when the mother's cervix begins to dilate. As a partner, you can provide comfort, help time contractions, and ensure she's staying hydrated and nourished. Active labor is when contractions get stronger and closer together. The cervix dilates more rapidly, and this is usually when mothers head to the hospital. Your role is to stay calm, provide physical support, and communicate her birth preferences to the healthcare team. Transitional labor, the final and most intense phase, marks the shift to the second stage of labor, delivery. Contractions are very strong, and the mother may feel overwhelmed. You can help by providing focused support, reminding her to breathe, and encouraging her that she's almost there. Now that you understand the stages of labor, you'll be well prepared to support your partner through each phase. Now let's talk about what you can expect once you arrive at the hospital. The first thing that typically happens is admission into the maternity ward. Here, your partner's vital signs will be checked and her progress in labor will be monitored. It's essential to ask questions and stay informed about the process. Next, your partner might be offered an epidural for pain relief. This is a personal choice, and it's important to respect your partner's decision. If an epidural is chosen, a trained anesthesiologist will administer it. There may also be possible interventions, such as an episiotomy or a cesarean section. These are usually reserved for emergencies or complications. It's crucial to trust the medical team's judgment and keep communication open with them. Remember, the hospital is a place of safety and support. Your role is to be there for your partner, providing comfort and reassurance. Knowing what to expect at the hospital can help you be a calm and supportive presence for your partner. Your role in the delivery room is crucial. Let's talk about what you can do. You're not just a bystander in the delivery room. You're an active participant, a pillar of emotional support for your partner in one of the most intense experiences she'll ever go through. One of your roles is to help with breathing techniques. Yes, those techniques you've seen on TV and in movies, they're real and they're helpful. Guiding your partner through those deep inhales and exhales can help her manage the pain and keep her focused. Another role you play is as an advocate for her wishes. This could mean communicating with the medical team, ensuring her birth plan is being followed, or just making sure she's comfortable. You're there to help her voice her needs when she may not be able to. Remember, your role in the delivery room is about supporting your partner and being there for her. Finally, let's talk about comfort measures and delivering the baby. One of the most impactful ways you can support your partner is through comfort measures. This can include anything from massaging her back during contractions to whispering words of encouragement in her ear. You're there as her rock, a constant source of reassurance and love. This is all about her and the incredible journey she's embarking on, and you're right there with her every step of the way. When the baby is delivered, it's a whirlwind of emotions. It's joy, relief, and a little bit of fear all at once. You might even find yourself shedding a few tears of happiness. It's the moment you've both been waiting for, and it's finally here. Remember, your role as a father begins before your child is even born. By being a supportive partner during the birthing process, you're already off to a great start.
Have you ever wondered about the role of men in the delivery room? Once upon a time, men were banished to the waiting room, pacing nervously as they awaited the arrival of their newborns. However, tradition has taken a back seat in recent years, with a whopping 90% of fathers now playing an active role in the birthing process. This journey begins way before the delivery room. It starts with the exciting moments of choosing nursery furniture, deciding on names, and attending Lamaze classes. Yet, despite the best of preparations, it's entirely normal for men to feel somewhat out of place when the big day finally arrives. But let's not forget that the sterile operating rooms of old have made way for more welcoming birthing rooms, where loved ones can share in the birth experience. Even with the best of training, guys may still feel out of place when attending the birth of a child. But remember, the birthing experience is something every guy can participate in. So you're about to become a father, and you're hearing all these horror stories. What's a guy to do? It's quite a predicament, isn't it? Well, let's navigate this emotional roller coaster together. It's completely natural to harbor fears and doubts about being in the delivery room. You may feel out of place, overwhelmed, even scared. That's okay. Remember, you're not alone in these feelings. Many men before you have walked this path and felt the same way. Now let's shift gears and talk about the upsides. Being present at the birth of your child can foster a deep sense of connection and involvement. Studies indicate that men who are present at the birth are more likely to be engaged in the care and nurturing of their children. It's normal to be called every name in the book and blamed for everything. It's probably going to happen, but remember, your presence matters. Labor has started. She's in pain. What do you do? As the contractions begin, her screams might fill the room. This is not the time to run errands or worry about your inadequacies. This is the time to step up, to be there, to be supportive. When labor starts, it's like a roller coaster ride that neither of you can stop. The contractions, the discomfort, the anticipation, it's all part of the journey. As the man in the room, you might feel helpless, but remember, your role is critical. You can provide comfort, hold her hand and reassure her. You can remind her to breathe, to relax, to focus. You can be her rock, her anchor amidst the storm. Remember, labor is a process, one that requires patience, strength, and lots of encouragement. Childbirth is painful, a pain you as a man can never know, but your supportive presence can make a world of difference. Did you know that a supportive birth partner can reduce a woman's need for pain-killing drugs? This isn't just a claim, it's backed by solid research. Being a supportive partner during childbirth does more than just hold hands and offer encouraging words. It's about being present, both physically and emotionally, providing comfort and advocating when necessary. The benefits extend beyond the delivery room. A supportive partner can significantly enhance a woman's satisfaction with her birthing experience. It's not just about the pain, it's about the journey. And when a woman feels supported, she feels empowered. But the support doesn't stop there. The transition into motherhood can be daunting, and having a supportive partner can boost a woman's confidence, reducing her worries and stresses about being a mother. The presence of a familiar face, someone who's been there through the journey, can be incredibly reassuring. With the help of this video, you'll be much more prepared for the birthing experience. Remember, your role in the delivery room is crucial and highly valued.
Are you ready to welcome a new life into the world? The journey to becoming a parent is a profound experience filled with anticipation, excitement, and a whole lot of love. It's also a journey that comes with its share of complexities, particularly when it comes to the process of labor and delivery. That's why it's so important to understand the stages of labor and delivery to empower you to confidently navigate this transformative journey. As you embark on this journey, it's essential to understand the stages of labor and delivery. The journey begins with the onset of labor. Labor is initiated by contractions, those rhythmic tightenings that signal the start of the birthing process. These may begin as sporadic sensations akin to a tightening or pulling in your back or groin, gradually increasing in intensity and frequency. The occurrence of your water breaking, or in medical terms, the rupture of the amniotic sac, is a clear signpost that true labor has begun. As we move into the early phase of labor, Contractions become more regular and intense, with the cervix taking on the task of softening, thinning, and dilating. The active phase is next, with contractions occurring approximately every 3 minutes and lasting 45 to 60 seconds. The cervix continues to dilate, reaching 10 centimeters by the end of this phase. Finally, we arrive at the transition phase. This is where the cervix dilates the final 2 centimeters. This phase can be overwhelming with intense contractions. But remember, transition is relatively short but can be the most challenging phase of labor. Once the transition phase is over, you move on to the delivery stage. This is the moment that has been building up from the start, the actual delivery of the baby. You might notice that your contractions slow down a bit at this point. This is because your baby is making its way down the birth canal and your body is preparing for the final push. The delivery stage begins when your baby's head is fully engaged in the birth canal. This heralds the start of the pushing phase. As the baby descends further, your contractions and your own efforts guide its passage. This is an intense, focused period as you work with your body's rhythms to bring your baby into the world. During this time, your birth attendant plays a crucial role. They monitor the baby's progress, watching its descent and positioning in the birth canal. They're there to ensure a safe and smooth delivery, ready to step in if needed. Delivery can be a test of endurance, but remember, each push brings you closer to meeting your baby. And then, before you know it, you'll hear your baby's first cry, feel their warmth against your skin, and look into their eyes for the very first time. With the baby's arrival, the second stage of labor comes to an end. The journey isn't over yet, but this is a moment to pause, to breathe, and to marvel at the miracle you've just brought into the world. The third and final stage of labor is the delivery of the placenta. This stage begins after the birth of your baby and ends when the placenta, the organ that nourished your baby in the womb, is expelled from your body. This process is initiated by a series of uterine contractions, which cause the placenta to separate from the uterine wall. These contractions, often less intense than those experienced during labor, guide the placenta out of the uterus and through the birth canal. It typically takes between 5 to 30 minutes for the placenta to be delivered after the baby. Throughout this stage, the birth attendant plays a crucial role. They will monitor the process, ensuring the placenta is delivered safely and in its entirety. They will also assess the mother for any potential complications, such as tears or injuries. With the delivery of the placenta, the labor process is complete. Labor and delivery can unfold rapidly or span hours, requiring unwavering support and guidance. A birth partner's role becomes crucial in this transformative journey. They provide a comforting presence, helping to alleviate any stress or confusion that may arise. They are there to hold a hand, offer encouraging words, and provide physical support, such as helping with breathing or relaxation techniques. But their role goes beyond just being there. A supportive birth partner also needs to understand the stages of labor and delivery. This understanding empowers them to better support the mother-to-be. They can anticipate the needs, know when to offer reassurance, and when to simply remain silent and supportive. The journey of childbirth, like any journey, is best navigated with knowledge and support. Understanding the stages of labor and delivery equips you with the tools to face this journey with confidence, resilience, and grace. Embrace the beauty and complexity of childbirth, knowing that you're supported every step of the way.
Ever wondered what happens the moment you step into a birthing facility? It all begins with registration. This crucial first step ensures that all your details are in order. If you've had the foresight to pre-register, you're already a step ahead. If not, don't worry, you'll complete this process upon arrival. Once all the paperwork is completed and you're officially registered, you'll be escorted to your birthing room. This room will become your sanctuary throughout your stay. With registration complete, you're ready for the initial assessment. Post-registration, the first step is the initial assessment. This involves a nurse or birth attendant checking the vital signs of the expectant mother, making sure she's in good health and ready for the journey ahead. They'll be recording these details meticulously, ensuring that everything is as it should be. The baby's well-being is also a priority. To keep a close eye on their condition, fetal heart tones and heart rate are monitored continuously. This gives the medical team a clear picture of how the baby is responding to the stress of childbirth. External monitoring is usually the go-to method, using an ultrasound transducer strapped over the mother's abdomen to pick up the baby's heartbeat. In some instances, internal monitoring might be necessary. This involves a fetal scalp electrode inserted into the vagina to measure the fetal heart rate and the strength of contractions. It's all part of ensuring both mother and baby are safe and healthy. With the initial assessment done, it's time for the intravenous IV line. Now let's dive into the IV line procedure, the internal examination, and the importance of communication. Most women will have an IV line inserted as a precautionary measure. This is to facilitate the administration of medications during labor if required. Next comes the internal examination. The birth attendant will assess cervical dilation and the baby's position. This is done with utmost discretion and care. Remember, it's critical to communicate any discomfort or concerns during this process. Now let's talk about communication and advocacy. The birth attendant will explain the labor process, answering any questions or concerns you may have. You'll also be asked to provide some general medical information. It's important to know that you have the right to challenge any procedures or interventions that you feel are unnecessary. With a clear understanding of the process and your rights, you can focus on providing comfort and support. Now, it's all about comfort and support. This journey into parenthood can be intense, but being attentive to the needs and emotions of the mother-to-be can make all the difference. Whether it's a soothing touch, a calming word, or just your presence, your support will be her strength. And remember, this is a journey you're on together. As you embrace this transformative journey, remember to navigate the challenges and joys of childbirth with resilience, trust, and anticipation.
Do you know how to be a supportive birth partner? It's a question that comes with immense responsibility and the potential to profoundly impact the childbirth experience. Being a birth partner isn't just about being present on the big day. It's about preparation, emotional support, effective communication, and much more. It's a role that requires patience, flexibility, physical support, and above all, trust and confidence. If you're ready to embrace this role, you're in the right place. Let's dive into the key responsibilities of a birth partner. First and foremost, preparation is key. Arm yourself with knowledge by attending childbirth classes together. This will give you insights into the stages of labor and delivery. Don't stop there. Delve into videos, books, and engage in conversations about the birthing process. Take the lead in ensuring the car is ready to go at a moment's notice, and that all the essentials for the hospital are packed. Proper preparation can alleviate stress and ensure you're ready for the big day. Providing emotional support and clear communication is crucial. Labor and delivery can be an emotional roller coaster, with feelings of pain, frustration, and fear often running high. During these intense moments, your role as a birth partner is to offer constant encouragement and reassurance. Remind her of her strength and resilience, and listen attentively to her needs and concerns. Understand that mood swings and changes in behavior are part and parcel of the process. Equally important is effective communication. Keep her informed about the progress of labor, including the duration and frequency of contractions. But remember, communication isn't just about information. It's about respect and advocacy too. Respect her wishes and preferences, and be her voice when she can't be hers. She needs to know that you are there, ready to advocate for her needs throughout the process. Your emotional support and communication skills can provide comfort and reassurance during this challenging time. Patience, flexibility, physical support, and trust are the pillars of being a supportive birth partner. In the throes of labor, your partner might express intense emotions. Stay calm and patient. Understand that any outbursts are manifestations of the physical and emotional intensity of childbirth. Flexibility is key. Be ready to adapt to the situation at hand, from changing comfort measures to making quick decisions. Remember, labor is a fluid process, and your ability to adjust can significantly ease your partner's experience. Physical support goes beyond holding hands. It can be a comforting massage, helping with breathing techniques, or adjusting her position. Your steady presence is a source of reassurance amidst the whirlwind of labor. Trust in yourself. You've prepared for this. You have the knowledge, the tools, and the strength to support your partner through this journey. Believe in your capacity to navigate the physical and emotional aspects of childbirth. By embodying these qualities, you can provide invaluable support to your partner during the transformative experience of childbirth. In conclusion, being a supportive birth partner is about more than just being present. It's about preparing together, providing emotional support, effective communication, and demonstrating patience. It's about being flexible and adaptable, offering physical comfort, and above all, trusting in your ability to navigate this journey. By embracing your role as a supportive birth partner, you can make a meaningful difference in your partner's childbirth experience, fostering a sense of trust, connection, and empowerment during this remarkable journey into parenthood.
Are you about to become a birth partner and wondering what to expect? The final push might be the most intense part of the labor process. It's a period of profound physical effort, where your partner will push with all her might to bring your baby into the world. Your role? To be there, fully present, offering encouragement and support. Let her know she's doing an incredible job, that she's strong, and that she can do this. Remember, your role is to be the pillar of support for your partner during this intense moment. The moment has come. The baby's head crowns and emerges. The world seems to pause, but in reality, the events progress rapidly. The baby's shoulders follow, a clear sign that your little one has arrived. It's essential to remain focused and attentive, absorbing every detail of this breathtaking moment. The atmosphere is filled with raw emotion and pure joy. You're witnessing the miracle of life firsthand. This is the moment you've been waiting for, the arrival of your baby. After the baby's arrival, the umbilical cord will be clamped and cut. This is a momentous occasion that signifies your baby's first step towards independence. You may be invited to participate in this symbolic act, a tradition embraced by many cultures worldwide. Rest assured, this procedure does not cause any harm to your baby or the mother. It's carefully performed under the watchful eyes of experienced medical professionals. Cutting the cord is more than a procedure. It's a symbolic gesture marking the baby's independence. Your partner will need your unwavering support and encouragement throughout the delivery process. Birth may be a physical endeavor, but it's also an emotional journey. Your words of reassurance, your comforting presence, can be as powerful as any medical intervention. Remind her of her strength and resilience, and let her know that she's not alone. Now let's talk about skin-to-skin contact. This is when the newborn is placed directly on the mother's chest, bare skin against bare skin. It's a beautiful, intimate moment that initiates the bonding process. But it's not just about connection. Skin-to-skin contact also helps regulate the baby's body temperature, heart rate, and breathing. It even stimulates breastfeeding. So as a birth partner, encourage this magical contact. It's a chance to marvel at the miracle you've both brought into the world. Remember, your support and the first skin-to-skin contact are essential for both the mother and the baby. After the birth, your partner will need you more than ever. Attending to her needs, from making necessary phone calls to providing comforting back rubs, becomes your priority. This is the time to strengthen your bond, cherishing quiet moments and capturing memories. But remember, communication is key. Ask your partner what she needs, how you can support her best. Stay by her side, offering comfort and love. Your role as a birth partner doesn't end with the birth. It's just the beginning of a beautiful journey.